It's time now for 814 Your Health Check, brought to you by Gloria Gates Care. We have Rhonda and Chelsea here from Gloria Gates, who are care advocates over at Gloria Gates. Ladies, thank you so much for joining us today.
Thank you for having us.
Nice to be here. Thank you.
Absolutely. So October is Health Literacy Month, and that's why you ladies are joining us today. And I want to talk about your roles as care advocates. You are kind of sort of the first touch point that these new members are going to be in contact with, and it's really important for them to really discuss things over with you, you know, maybe potential prescriptions they have, just concerns maybe with seeing a new doctor, that they can, you know, really get in contact with you and go through all of those things.
Yes, I mean, they ask a lot of questions. Some ask a lot of questions. Some are like, oh, okay, and it might be a couple days. Then they call back and say, I got a bunch of questions to ask. It's like it's got to sink in.
Yeah, you really, you know, because it can seem like the smallest thing, but then it comes into your head and you're like, oh, okay, I need to ask them about that. So that's something that, that's kind of where you come in. Yeah, absolutely, yes. So, you know, we're talking about health literacy. And in today's world, it can sometimes, you know, seem a little confusing just having to deal with everything, right? You know, like prescriptions, appointments. What do I really need to focus on? Okay, I saw the doctor. I don't remember exactly what he was telling me. So that is really something that you're emphasizing with your members.
Yes.
Yeah, we're able to just kind of come in after the fact and say, like, this is what we talked about. This is what went on at your appointment today. Can you let me know if you have questions? We're really just trying to build that trusting relationship with our patient to let them know we're here for them. We heard what they heard. We know what they know. And medical literacy is a huge problem, specifically in the population we're serving. There's a lot of information being thrown at you, so it can be very overwhelming. I will say our providers at Gloria Gates Care, they very much take the time to make sure the patient is understanding. But it's just nice to know that you have someone like a care advocate to kind of rely on just as a backup in case you ever get confused. And like it goes back to the social determinants of health. Medical literacy is the very first question we ask these patients. If they have a question, they have a concern with medical literacy, we're able to be there for them. We can assist them actually in the room. We can be present during their appointment. And we're just always constantly making sure that they're aware of what was told to them, and making sure they feel comfortable is most important. Yeah,
absolutely. Kind of providing that sense of comfort, like you said. But what are some of the more popular questions that you guys get? Can you think of anything off the top of your head?
A lot of it sometimes is they might need help finding housing. They might need help finding like food banks and stuff like that. Transportation is one thing that keeps a lot of people from their medical appointments and stuff like that, is lack of transportation. So a lot of it is basically housing, food, transportation, help with electric bills, help. Where do they go to get this help for the electric bill, or where do they go to get this help for all this other things? So we point them, we give them the resources to make the phone calls, and sometimes we'll actually, because sometimes we'll step in and make a phone call and say, hey, we're talking to so-and-so, they need this and this, can they call you? And so we've already put our input in, and the patient or member has to follow up.
Gloria Gates is really all-inclusive care. When they say that, they mean literally helping you through everything. But can you ladies just maybe think of something that really separates Gloria Gates Care from the rest?
We are completely and 100% just focused on the patient and the patient's well-being. And it's really a whole person care approach. We just cannot stress that enough. The social determinants of health, we're making sure you have food, we're making sure you have housing, we're making sure you have transportation. You can't get medical care if you can't get to your doctor appointment. A lot of the places and, you know, bigger companies around here, they don't offer that, and it's not as readily available as you would think it is. So we're just so focused on just making sure these patients are taken care of, because 85% of what happens to these patients is happening outside of the medical office. So if you can break down those barriers and really get to the core of what's going on outside the office, it's much easier to treat the patient.
Absolutely, and if you're interested in any of their services, we have plenty more information over on our website, WTAJ.com/Studio 814. Just head to that Your Health Check tab. Ladies, thank you so much.
Thank you.